My name is Alvin, and I love to dance, go to concerts, plays, and I love to play bridge. I've had glaucoma for about 20 years, so I've been using drops 3 times daily, and eventually it didn't work. The pressure was not going down, and I've had laser surgery. I've had trabeculectomy 10 years ago. Since it wasn't doing any good, I've come to the point of no return where I had to have some other type of surgery or go blind. So
we've had one botched surgery. The right eye is practically gone. He sees images only, or outlines of different things, so he's depending on that left eye to do the work of 2 and not 1 anymore.
It was my doctor that I've been going to for years, and he recommended my coming to Dr. Richardson. I decided to go with the canaloplastic surgery.
When the other doctor suggested we see Dr. Richardson, we knew that might be our only and last chance for vision.
He was very informative, very skillful at what he does, and he had a good outcome.
My father was a patient of glaucoma. If we had known there was a Dr. Richardson around with canaloplasty, it would have been perhaps a whole lot better outcome, because he lost his sight, and we had to reconfigure the house, so to speak, so that he could get around in his apartment with familiarity, you know, and holding on to chairs from one chair to another to get from point A to point B until his lifetime was over. There was no Dr. Richardson then, and that was an outcome that, knowing what my husband was going through, in the back of my mind, I knew that in time, if he doesn't have the sight in the remaining eye, then of course it's going to be a big problem for both of us and the family too.
With the canaloplastic surgery, I've used less drops, and the pressure is down, and the only problem I had with the canaloplastic surgery was that I was blind for a couple of weeks, and I had to be escorted around. My wife had to escort me around.
Because right after the canaloplasty, it was on my shoulder, even coming to this office, on my shoulder from your parking lot to the step up in the back.
But after that, my eyesight cleared up, and my vision is better, and I'm able to use less drops. In fact, I've only used 1 drop instead of 3.
And you can see how he comes in now. He can see, he holds the door open for me and stuff like that.
I'm very appreciative of what Dr. Richardson has done, and I would recommend it to anyone, as far as being a safe procedure, and maybe not even have to use drops. I find Dr. Richardson's office to be quite friendly, warm-hearted, and very informative.
Let me give you all the plaudits and kudos in the world, because we saw from the get-go how professional you were. You take care of business. The office staff takes care of business. The financial lady, Hella, takes care of the business that she needs to take care of. And I was delighted when you asked us to come today, because otherwise we wouldn't see you again, and I wanted to see you again.
Isn't that
so here we are.
Yeah.
I couldn't be happier with the outcome with Alvin, because this is my love of many years, and I want him to have all the sight he can have until he closes his eyes permanently. Whichever one of us goes first, who knows? But by the same token, I want him to enjoy his life. I want him to enjoy his family, grandkids, etc. And we have a lot of fun with all the family, because we're big family people. Celebrate all holidays, birthdays, etc. And We want to have that quality of life that you get when you have your eyesight.
Oh, I'm very pleased and happy with the fact that I'm using less drops, my pressure is down. Yes, it's down, and quite pleased, really.